All right, let's get into it. Today, we're going to unpack the really complex world of liver disorders. And I want you to think about it less as a single problem and more like a domino effect, a chain reaction where one thing goes wrong and it just triggers this whole cascade of consequences throughout the body.
So let's just start with one central question. What actually happens when your body's main filter, the liver, starts to break down? The answer to this really sets the stage for everything we're about to talk about.
First up, the first clues. These are the initial signs, and honestly, some of them are pretty surprising. They're the things that signal that something is seriously wrong with this incredibly important organ. Your body sends out some pretty clear distress signals. You might see jaundice, which is that classic yellowing of the skin. A person might start bleeding or bruising super easily, and that's because the liver isn't making the stuff it needs to help your blood clot. And then you get this really strange phenomenon called chicken legs, where someone has really skinny arms and legs, but a big, swollen abdomen. And inside, toxic stuff like ammonia starts building up in the blood. The key here is that these aren't just random problems. They are all connected.
So, that swollen abdomen we just mentioned, it's got a name, ascites. And let's be super clear, this is not fat. It's a really serious buildup of fluid right in the abdominal cavity. And it's a direct result of pressure building up in the blood vessels around the liver. We're going to get into exactly why that pressure builds up in just a minute.
Okay, so what's causing all of this? Well, a lot of the time, the root of the problem is actual physical damage to the liver itself. Let's take a look at a condition called cirrhosis.
See, cirrhosis isn't something that just happens overnight. It's a slow, destructive process. It all starts with some kind of initial damage, right, that leads to inflammation. Now, your body tries to heal itself, but instead of making nice, healthy new liver tissue, it makes scar tissue. And over time, this tough, useless scar tissue just takes over, and the liver, well, it just can't do its job anymore.
So where does that initial damage even come from? Well, there are a few usual suspects. Chronic alcoholism is a really common one. Certain medications, we call them hepatotoxic drugs, can also be really hard on the liver. And then you have conditions like primary biliary cirrhosis, where the problem starts with the bile ducts, but ends up causing that very same destructive scarring process.
All right, so besides damage from things we put in our body, another huge cause is viral infections. The different types of hepatitis are a massive factor when we talk about liver health.
Now, let's break this down, because not all hepatitis is the same. Hepatitis A is usually acute. That means it's a short-term thing, and you get it from contaminated food or water. Pretty straightforward. But hepatitis B and C, they're different. They're spread through blood and body fluids. The really crucial difference, they can both become chronic, long-term infections that just keep damaging the liver for years. And while we're lucky to have vaccines for A and B, there's still no vaccine for hepatitis C.
Let's just focus on hepatitis C for a second, because it's so sneaky. It almost always becomes a chronic condition, and without a vaccine, knowing if you're at risk is everything. This is why screening is so important for certain groups, specifically baby boomers and anyone who might have had a blood transfusion before 1992. That's because the blood supply wasn't screened as rigorously back then.
Okay, so it doesn't really matter how the liver gets scarred, whether it's from cirrhosis or chronic hepatitis. The end result is a massive mechanical problem. I want you to picture a giant, nonstop traffic jam happening right inside your body. That's basically what's going on when blood can't flow through a scarred-up liver.
And yeah, this traffic jam has a fancy medical name, portal hypertension. It's basically dangerously high blood pressure, but it's specifically in the veins that lead to the liver. That scar tissue we've been talking about, it literally acts like a roadblock. So all the blood that's trying to get through the liver gets backed up, and the pressure just builds and builds and builds.
And as you can imagine, a backup like that has serious consequences that just ripple outwards. That intense pressure forces fluid out of the blood vessels and into the abdomen. That's the ascites we saw earlier. The blood also has to find other ways to go, so it backs up into smaller vessels, like the ones in your esophagus, causing them to swell up dangerously. And your spleen, which is trying to help filter all this backed up blood, gets totally overworked and enlarged.
Okay, this is where things get really, really serious. We're at the end of that cascade with the most critical and life-threatening results. When the liver can't filter anymore and the pressure just keeps building, it can lead to major brain problems and, well, a catastrophic bleeding emergency.
Hey, remember that ammonia we mentioned at the very beginning? Well, here's where it becomes a huge problem. A healthy liver cleans ammonia out of your blood no problem, but when it's failing, that ammonia just builds up, travels to your brain, and creates this toxic condition called hepatic encephalopathy. It's literally poison for your brain, causing confusion, big personality changes, a really serious decline in brain function.
So how do doctors deal with this? Well, they use a medication called Lactulose. And there's a pretty memorable way to remember how it works. Lactulose makes you loose. It's basically a very powerful laxative that grabs onto all that ammonia in your gut and gets it out of your body. So you're literally clearing out the toxin to help clear the patient's mind.
Okay, let's go back to those swollen blood vessels in the esophagus, the varices. To really get what's happening, let's use a kind of strange comparison. Acid reflux during pregnancy. When a woman is pregnant, the growing baby puts pressure on the stomach, which can push acid up, right? Well, in liver failure, it's the scarred, enlarged liver putting that pressure on the stomach. But here's the critical difference. Instead of just pushing up acid, it forces blood to back up into the fragile vessels of the esophagus, causing them to swell up like overinflated delicate balloons.
And here is the bottom line, the absolute critical takeaway. If one of those swollen, fragile balloon-like vessels ruptures, it is an absolute, life-threatening medical emergency. The internal bleeding can be sudden and it can be massive.
You know, when you stop and think about it, from filtering every toxin you encounter to creating the proteins that stop you from bleeding, your liver performs over 500 essential functions. Seeing just how catastrophically things can go wrong when it fails really puts its importance into perspective, doesn't it? Which kind of leaves us with one last big question. What can you do to protect this incredibly hardworking organ?